For having us. My name's Mike Strachan. I'm joined with Akanksha and Andy. We're from Magentus. We're going to do a demonstration of the Magentus e-request. We are going to demonstrate today what we've done in pathology and radiology using the same AU e-requesting standard that's been developed through Spark. It's important to understand that this is a workflow pattern that supports a service request and fulfillment by the placer and the filler, and Andy will touch on that throughout the presentation. It's key to really importantly understand that it's very different from a HL7 messaging model where a message is delivered and then the job is done. We're doing a back and forth interaction between Magentus and our diagnostic partners. For today's demonstration, we're going to demonstrate Sonic Radiology's workflow, Healius pathology workflow, and ACL pathology workflow. Sonic also do have pathology as well. However, just due to time constraints, that's what we'll demonstration today. I'm going to hand over to Akanksha and Andy. Thanks, everyone.
All right, so this is a patient, John, and I'll create a pathology request for him. This request is for Australian Clinical Labs. It's gone for the lab to pick it up. I'll create another request in parallel for another patient. All the clinical information, pregnancy information, that's already pre-populated in here, and that will go along with the request. This request is for Jane for Healius pathologies. Now we can see these requests are here for Australian Clinical Labs and Torevich. And once the lab starts accepting it, making it in progress or completing it, the statuses will be reflected in here.
Traditionally, HL7 version 2 based messaging has not provided transparency of fulfillment by the filler. In our approach, the clinician can see when a request has been placed, when it is picked up by a filler, when the patient arrives for collection, and when the report has been completed. This transparency ensures greater focus on the clinical collaboration between the clinician and the pathology service, providing greater transparency, trust, and patient safety. You might notice some delay in the statuses being updated in the user interface. This is normal because the demonstration is a little artificial as the status changes happen over time and are not packed together in a real-time sequence as you're seeing in this demonstration.
You can see once the request is completed, you can start seeing here. The one for ACL is completed now. And similarly, when the lab has the request and it is in progress, that would also start getting reflected in here for the lab here. See, this one for Dore, which is now in progress. All right, I will start with creating a radiology request for this particular patient. I'll select a lab, which is a digital lab.
We distinguish digital labs from traditional address book labs. Digital labs have a capability to receive digital orders, while address book labs may not.
Sends an SMS to the patient. You can also print and keep a copy. Otherwise, you can start seeing the results in this section for this patient. So right now it's requested, but then once the lab accepts it, it will start changing statuses, and you can start seeing all the statuses right here from in progress to completed afterwards. You'll start seeing all the statuses here as soon as it's in progress. Now you can see that this request is in progress, which means that the patient has turned up at the radiology center for getting their test done. And then this information is shared with clinician. Now, once the test is completed, you can start seeing the status as completed for the request. Now, as you can see, that the status is completed, and that is reflected everywhere for this particular patient. That's a radiology order all the way through.
Thanks for the great presentation, Akansha and Andy. Just want to close our demonstration with a discussion about where we're headed in the future and some of the future opportunities that we see using the AU e-requesting standard that are developed through Sparked. For certain things such as extended clinical history, looking at AU patient summary and potentially attaching that to the request, which would be really exciting potentially in the future. Round tripping the report, the request, the report going back to the request and round tripping that back onto the FHIR repository. Certainly looking at decision support into the future as well. But right now we are focused on working with Sonic, Healius and ACL on what we call digital request sharing or alternate lab claiming, which is the ability for a consumer's digital data to follow them to whichever diagnostic pathology service that they use. We're estimating that launch will be sometime in June. We're very excited about this because we think this is a step towards supporting the current patient-consumer choice setting that patients' digital data can follow them in the ecosystem. Thank you all for your attention.